My father was a physician, so healthcare is sort of the family business. I've got a younger brother who's a physician, a sister who's a nurse. Got out of medical school, became a practicing physician, loved it, loved seeing patients. I also thought I would like to sort of help people on maybe a larger scale. So going back to business school, learning some new tools, and then being able to sort of process things and understand how I might do things on a grander scale. Because of our roots, because we started during another pandemic or an epidemic, we're not afraid of patients, we're not afraid of diseases, we're not afraid of illnesses. And so because that's our roots, our foundation, who we are, we quickly rose to the occasion to start addressing people who had needs, patients who had needs. We were one of the first to set up testing centers in the city, and then our staff, amazing. They all jumped in and tried to sort of find the best way to help patients. I sort of, right or wrong, treat everything sort of in a healthcare medical space. So when I walk into a new role, the first thing is I treat the organization like it's a patient, right? So is a patient having a heart attack, or are we having sort of a hangnail? So when I first got to Legacy, we had to make sure that patients still had access to care across all of our locations. And then once that was done, to make sure our staff felt safe, that they could come in and then they could do their job, make sure their families were safe, and how could we assist with that? And then make sure our staff was able to see patients, then sort of making sure that our patients then had the resources they need, because everybody was struggling, right? People had lost their jobs, they had no money, they couldn't pay their bills, so it was a whole host of things we had to do. But the key for me was prioritization. As new leaders, we do the best, get information that we can, and then we make a decision and we execute. Knowing it may be 80% correct, but you can adjust the rest on the fly, that 20%. But I think inaction is also a dangerous thing after you've got enough information to make a decision. So inaction is also something I would advise a new leader not to fall prey to. I think that people were scared, right? So you can take care of people physically, financially, but trying to make people feel comfortable that what's going to happen, what they're going to be exposed to, what they're going to do, and what they're going to be exposed to their families is something that was harder to do, a reassuring trust that we understand how you're feeling, and helping people go through that was really challenging. With the pandemic, the way Legacy was able to change our strategy was we still were able to deliver. So patient came into the front desk, they checked in, they went to see a provider in the exam room. All that was the same, and we do it really, really well. Now, the piece that was challenging was after a patient was seen by a provider, they still had needs. And no matter how amazing a provider is, if a patient is dealing with the basic necessities of life, food, clothing, shelter, housing, lack of money to get their medication, they won't get better. We have to divert more resources to make sure we were addressing those needs that patients had. Understanding the importance of behavioral health and how life stresses can really amplify the need was something that we knew there was a need for behavioral health, but the pandemic brought out so much more realization of that need that I am very proud that we have really sort of increased our behavioral health department to employ almost 40 psychiatrists and over 100 therapists to make sure that we can address the needs, and it's still not enough. We realize that the pandemic brought that out tenfold. My goal is to make sure that Legacy is able to take the great things we do and increase that access to care wherever the need is. And unfortunately in Houston and in the surrounding areas, there's plenty of need. Make sure that patients can get the care they need, those we have and those we don't have yet. Legacy and the old Montrose Clinic They saw people when nobody else wanted to. That is our roots, and that will always be something we will do always and forever.